If you or a loved one are coping with cancer, you likely have many questions about the resources available in Western New York. The Cancer Services Program of Erie County provides free breast, cervical, and colon cancer screenings for the uninsured. Recently, I had a chance to meet the experts from the Cancer Services Program to update us on how they can help you. We're here with the Cancer Services Program of Erie County, with Michelle Wysocki, who is the program director, and Patricia Beecher, who is the case manager. Hello, ladies, and welcome.
Hello.
Hi, Kim. Thanks for having us.
Oh, you know, you guys do so much for our Western New York community. What you do is so important, so valuable, and we really are hoping to get the word out for our local Western New York folks who may be struggling with some medical situations that you can help them with. And so why don't we start with Michelle. What is Cancer Services Program?
Well, Cancer Services Program is actually a statewide initiative. There's a program in every county of the state, and it's established many years ago. Actually, 1992 is when the program started.
What services do you provide?
Well, that's a great question. We provide breast, cervical, and colon cancer screening services to both men and women, primarily over the age of 40 up until the age of 64. There is some allotment for people to be enrolled at a younger age if they have some kind of an urgent need or a higher risk assessment than usual. We have over 100 healthcare providers and facilities in Erie County that actually provide the services. We enroll the individuals in our program. We make the appointments for the men and women, and we cover, most importantly, cover the cost of all the services.
That's excellent. So you're really the pathway for individuals to have the opportunity to be on top of their health.
Right, and not only do we cover the screening services, but we also cover the diagnostic services if need be.
Excellent. So there's no reason for someone not to take part in or take advantage of these services based on finances, because it's there, it's covered, and New York State understands how important it is to have access.
Correct.
And Pat, case management.
Oh, case management is a vital part of our program. Anyone who has or is in need of any additional services that Michelle spoke about, we provide those free of cost. We make sure that they get the diagnostic tests that they need right through biopsy. This could mean additional mammograms, it could be a breast ultrasound, it could be, as far as cervical goes, it could be a colposcopy. These are all things that we follow, and we make sure that the patients get the additional services that they need. You
don't leave anyone hanging.
We do not. It is a comprehensive program for men and women. But actually, for the men, our biggest thrust is for the colorectal part. We provide for people 50 and over, including men, a take-home colon cancer screening kit that they do in their own home. It's called a FIT kit, and it detects occult or hidden blood in the colon.
Wow.
If that ever turns out to be positive, we then send them on for a free colonoscopy.
That's really, really great. I know that people are intimidated with the idea of having a screening for colorectal cancer and the colonoscopy, and I would think having that take-home kit would take away a lot of the uneasiness.
Well, you're right, and you know, as everybody knows, the best test is the one that gets done. Yeah. So if they're not going to have the colonoscopy, this has been proven to be a very good way for them to detect if there's a problem.
Now, Pat, in the event that a person does have a test come back positive, what do they do?
Well, first of all, we have what is known as the Medicaid Cancer Treatment Program that was instituted in 2002. And what it does is anyone who has a positive biopsy, as I mentioned, we pay through biopsy. Once that comes back positive, we are able to enroll these in a special Medicaid program. And it's been a lifesaver, literally, for many women. Sometimes people call us and they're afraid of having the test done because the next question is, what if? So this is a wonderful program. It's a very simple application. They come down to my office and meet with me, and within a week to 10 days, they are enrolled in this very special Medicaid program.
So the what if is actually something not to be afraid of.
Exactly.
Because that information that they're going to get when they have these tests done isn't going to leave them hanging with, now that I've been diagnosed, what do I do? Now that I've been diagnosed, Pat's going to see to it that you get treatment.
Yeah, exactly.
Where would one go for services?
As I mentioned, they call our number. We have a main intake number to call, and then we would make arrangements for the man or woman to receive services at any one of a number. As I say, we have over 100 providers in Erie County. Every one of the hospital systems is enrolled in our program.
You're making these services accessible. You're making these services less intimidating.
Yes.
And hopefully then encouraging, the folks here in Western New York to stay healthy.
Right, exactly. That's what it's all about.
Well, thank you, Pat. And, thank you, Michelle. What you're doing here in Western New York is so important. You are saving lives. So Western New York, make sure that you take advantage of the Cancer Services program that Pat and Michelle are ready, willing, and happy to provide. The Cancer Services program of Erie County is here to help. They provide free breast, cervical, and colon cancer screenings for the uninsured. To find out more, here's an important website that has everything you need to know: cspwny.org. That's www.cspwny.org. Thanks for watching this edition of What's the Buzz in Western New York. I'm Kim Piazza, and I'll see you next time here on WBBZ-TV, your hometown television station.